When does implantation bleeding usually occur? A. 5 to 7 days after fertilization. B. 2 to 3 days after fertilization. C. Immediately after ovulation. D. 10 to 12 days after fertilization. Correct answer, A. 5 to 7 days after fertilization. Which of the following indicates a pathological cause of abdominal pain in pregnancy? A. Braxton Hicks contractions. B. Constipation. C. Ectopic pregnancy. D. Pressure from the growing uterus. Correct answer, C. Ectopic pregnancy. How can nurses differentiate cervical polyp bleeding from other causes of bleeding in pregnancy? A. By identifying painless, localized bleeding after examination or intercourse. B. By noting cramping pain before bleeding. C. By confirming the presence of tissue passage. D. By observing dark, clotted blood from uterine rupture. Correct answer, A. By identifying painless, localized bleeding after examination or intercourse. What is the most common gynecological cancer diagnosed during pregnancy? A. Ovarian cancer. B. Endometrial cancer. C. Carcinoma of the cervix. D. Vaginal cancer. Correct answer, C. Carcinoma of the cervix. What is the definition of a spontaneous miscarriage? A. Loss of pregnancy after 28 weeks. B. Intentional termination before 20 weeks. C. Expulsion of fetus before implantation. D. Natural loss of pregnancy before 24 weeks. Correct answer, D. Natural loss of pregnancy before 24 weeks. Which test is used to identify genetic causes of recurrent miscarriage? A. Hormonal assay. B. Karyotyping. C. CT scan. D. Hysteroscopy. Correct answer, B. Karyotyping. Which is the most common site of ectopic pregnancy? A. Cervical canal. B. Ovary. C. Fallopian tube. D. Abdominal cavity. Correct answer, C. Fallopian tube. What is cervical insufficiency? A. Premature rupture of membranes before 37 weeks. B. Painful dilation of the cervix during pregnancy. C. Painless cervical dilation leading to pregnancy loss or preterm birth. D. Infection of the cervix causing miscarriage. Correct answer, C. Painless cervical dilation leading to pregnancy loss or preterm birth. Which appearance is characteristic of a hydatidiform mole? A. Cobblestone. B. Grape-like. C. Spongy. D. Smooth. Correct answer, B. Grape-like. What are uterine fibroids also known as? A. Adenomas. B. Leiomyomas. C. Endometriomas. D. Cystadenomas. Correct answer, B. Leiomyomas. Which is not a complication associated with multiple pregnancies? A. Gestational diabetes. B. Preterm labor. C. Placenta previa. D. Hypothyroidism. Correct answer, D. Hypothyroidism. What causes the ligaments of the pelvis to loosen during pregnancy? A. Increased progesterone. B. Increased relaxin. C. Increased estrogen. D. Decreased cortisol. Correct answer, B. Increased relaxin. What is the definition of antepartum hemorrhage? A. Bleeding after 12 weeks and before labor. B. Bleeding before 20 weeks of gestation. C. Bleeding from the genital tract after 24 weeks and before labor. D. Bleeding during the first trimester. Correct answer, C. Bleeding from the genital tract after 24 weeks and before labor. Which placental condition often requires cesarean section? A. Placenta previa. B. Placental abruptio. C. Cervicitis. D. Vasa previa. Correct answer, A. Placenta previa. Why does bleeding occur in placenta previa? A. Due to uterine rupture. B. Because of separation of the placenta as the lower segment stretches. C. Due to trauma during intercourse. D. From ruptured varicose veins. Correct answer, B. Because of separation of the placenta as the lower segment stretches. What is placental abruptio? A. Placenta implanted in lower uterine segment. B. Premature separation of a normally situated placenta. C. Infection of the placental tissues. D. Retention of placenta after delivery. Correct answer, B. Premature separation of a normally situated placenta. Which maternal condition most strongly predicts placental abruptio? A. Previous antepartum hemorrhage. B. Obesity. C. Anemia. D. Nulliparity. Correct answer, A. Previous antepartum hemorrhage. Why might implantation bleeding be mistaken for a menstrual period? A. Because it lasts for 5 to 7 days. B. Because it occurs around the expected period time. C. Because it has clots like menstruation. D. Because it causes abdominal cramps. Correct answer, B. Because it occurs around the expected period time. Which of the following is a non-pregnancy related cause of abdominal pain in pregnancy? A. Chorioamnionitis. B. Gallstones. C. Placental abruptio. D. Preterm labor. Correct answer, B. Gallstones. Why does cervical ectropion commonly occur during pregnancy? A. Decreased estrogen levels. B. Cervical trauma during intercourse. C. Increased estrogen levels. D. Bacterial infection of the cervix. Correct answer, C. Increased estrogen levels. What is the most frequent presenting symptom of cervical cancer in pregnancy? A. Abdominal pain. B. Vaginal bleeding. C. Painful urination. D. Nausea and vomiting. Correct answer, B. Vaginal bleeding. When does an early miscarriage occur? A. Before 8 weeks. B. Before 10 weeks. C. Before 12 completed weeks. D. Before 20 weeks. Correct answer, C. Before 12 completed weeks. What is the definition of recurrent miscarriage? A. Loss of 2 or more pregnancies. B. Loss of 3 or more consecutive pregnancies. C. Loss of a single pregnancy after 20 weeks. D. Loss of multiple pregnancies with different partners. Correct answer, B. Loss of 3 or more consecutive pregnancies. What is salpingotomy? A. Removal of the uterus. B. Removal of the ovary. C. Incision in the fallopian tube to remove the pregnancy. D. Tying of fallopian tubes. Correct answer, C. Incision in the fallopian tube to remove the pregnancy. What is the primary function of the cervix during pregnancy? A. To promote cervical contractions. B. To remain firm and closed until term. C. To expand rapidly in early pregnancy. D. To produce hormones for implantation. Correct answer, B. To remain firm and closed until term. What investigation confirms cervical insufficiency? A. Abdominal X-ray. B. Transvaginal ultrasound. C. MRI scan. D. CT scan. Correct answer, B. Transvaginal ultrasound. What is a possible indication for emergency circlage removal? A. Premature labor or membrane rupture. B. Fetal growth restriction. C. High blood pressure. D. Gestational diabetes. Correct answer, A. Premature labor or membrane rupture. What best describes gestational trophoblastic disease? A. Abnormal fetal heart development. B. Abnormal placental development with no viable fetus. C. Abnormal ovarian cyst formation. D. Uterine fibroid growth during pregnancy. Correct answer, B. Abnormal placental development with no viable fetus. Why is antepartum hemorrhage considered a serious obstetric emergency? A. It affects only the mother. B. It causes minimal bleeding. C. It contributes to maternal and perinatal mortality. D. It occurs rarely. Correct answer, C. It contributes to maternal and perinatal mortality. How is bleeding in placenta previa typically described? A. Painful and bright red. B. Painless and bright red. C. Dark and clotted. D. Associated with contractions. Correct answer, B. Painless and bright red.